We simply don't know at this point. There are clinical studies that suggest that it does. Those studies have some problems. There are clinical studies that suggest that it does not. We simply do not know if prostate cancer screening saves lives. Well, the tests themselves are not harmful. The end results are. We actually have in the United States a higher suicide rate amongst men who end up getting screened and start worrying about their PSA. We actually, one of the harms that we do know occurs is a substantial number of men who are cured of prostate cancer actually had a disease that, if left alone, never would have bothered them. About 50 to 60% of men who we actually treat, we actually now believe don't need to be treated. And unfortunately, we don't have a good test to say, Mr. Jones, you have disease that needs to be treated. Mr. Smith, you have disease that needs to be watched. You can have disease that looks aggressive under the microscope, and I routinely recommend that those men get treated. However, I don't tell them that they definitely have to get treated. I tell them I think it's a good idea to be treated, as opposed to I know it's a good idea to be treated. I recommend that men have a good conversation with at least one urologist, at least one radiation oncologist, perhaps a medical oncologist who does not have a vested interest, and come to a decision about treatment. Men need to know the potential risks and realize that there are potential risks. They need to realize that there are some potential benefits, and the individual man needs to make a decision. Literally, no professional organization today says all men should be screened. They say men need to make a decision after understanding this problem.